We will talk about patient counseling in the following 10 minutes. Who's supposed to give patient counseling? It's the major duty of the pharmacy for the pharmacist to give a proper counseling rather than dispensing medication only. He's assisting patients to use their medication in a proper way. How can the pharmacist achieve this proper counseling? Let us see the definition of counseling before moving to that point. Patient counseling defined as solving patient problem to improve their quality of health and life. How can we achieve this counseling? By good communication skill, to give the patient better understanding of their illness and medication, to improve their adherence to their treatment, to have more effective treatment, and to reduce the side effect from the drug that he's using toward better quality of life. What are the key points that the pharmacists are using to counsel the patients? When the pharmacist starts counseling the patient, he should inform the patient about his medication name and the dosage form, how he will take the medication, what is the frequency of taking this medication, and the duration. He should inform the patient for any warning about his medication and any specific instruction that he should follow during taking the medication. For example, if the medication should be taken at bedtime because the medication causing dizziness, or if the medication should be taken with food or without food. The patient should know about the purpose of taking the medication and what's the outcome of the treatment. He should know also about the drug and food interaction, if it's happening with the medication that he's using, so he can prevent taking both medication or taking the medication with the food. We have to inform the patient about the storage condition of the medication, if the medication should be kept in the ref or should be kept at room temperature, or if the medication need to be freeze, or if the medication should not be kept in the freezer. In addition, if there is any specific instruction to be given to the patient for preparing his medication, it should be clearly endorsed to the patient. For example, the way of preparing injections of insulin for diabetic patient, or how to prepare the syrup solution for the patients, the pediatric patients. So the family should be instructed how to prepare the medication and how to dilute their medications. We should teach the patient what to do in case of missing dose, in case of any side effect that can be observed or can be happen with administering the medication. This is clearly should be endorsed to the patient, so he know what side effect may happen during the treatment. And lastly, we should inform the patient the proper way of disposal the contaminated medication, like chemo drugs or like the injection. to prevent any harm to the patient and the family member. The most important thing in counseling is the communication skill of the pharmacist. This will lead to effective communication and effective counseling to the patient. Effective communication will lead to delivering the message to the patient clearly, and it will be valid that the patient will follow the instruction in detail, which giving a better adherence and better understanding of the treatment. The pharmacist should learn how to communicate effectively with the patient by having a verbal communication and non-verbal communication to have better understanding from the patient. He should break all the barriers between him and the patient. He should use his skill in getting the attention of the patient to get the all information needed for him to use during his treatment. So the aim of counseling is to ensure the patient know how to take their medication safely and in a proper way. Always we have to make sure that every patient should leave the pharmacy knowing what their medication are for and how to take their medication. Patient counseling lead to positive behavior by which the patient is motivated to adhere to their medication. Thank you.